everyone. Welcome to the special segment of the Ziva Moment Show. I'm your host, Akushika, and today we are excited to tackle a topic that is close to many of our hearts: breast cancer awareness. I know most of you are wondering why I'm excited about breast cancer awareness. You'll get to know soon. As we all know, October is Breast Cancer Awareness Month, and we are dedicating this episode to shedding light on this critical issue. Joining me is Dr. Jessie Akpiankran and Miriam Yako to educate us about breast cancer. You're welcome to the Ziva Moment once again.
Thank you.
Can you introduce yourself to us again?
I'm Dr. Jessie Appiakran. I work with the Ghana Health Service at Labraka Polyclinic, and I am a primary care doctor.
Okay. You.
And I'm Miriam Nyako, a nurse at Labraka Polyclinic, and I work with Ghana Health Service as well.
Okay. So to start with, Dr. Jessie, can you please tell us a bit about breast cancer?
So breast cancer, like all other cancers, is an abnormal growth or change of the normal body cells.
Okay.
Breast cancer is usually talked about in the past few years because it's the commonest female cancer worldwide and also in Ghana.
Okay.
Yeah.
So why is the awareness important?
The awareness is important because when people are aware, they know what to look out for. If they find something off, they know who to approach. So early detection gives us peace of mind. That's if there's no disease, or even if there's a disease, you get to find out early and gives us better outcomes.
Okay. Let's Miriam, what emotional support does breast cancer patients need?
Okay, so people suffering from breast cancer or breast cancer survivors need emotional support, like you said. So we take them through counseling sessions. We provide professional counseling at the hospital. There's a need for them to also, there's a need for the families to also come on board and support them, because sometimes they are left alone. They feel so lonely. So when the love from the family and then close friends are there, they feel a bit safe. And also support groups. There's a need for them to also join support group, breast cancer survivors. Then they will know that there is hope, because people who have been diagnosed of having breast cancer at a point survived, went through treatment and survived. So I think when there's support groups and then they join those support groups, they will feel a bit at home and feel okay.
Okay, so how do you help patients cope with the treatment of the side effects of breast cancer?
Okay, thank you very much. People suffering from breast cancer and have gone through treatment, mostly they are faced with anxiety, depression, having gone through the whole thing, because even some of the treatment options, you become bowed, you lose weight, and a whole lot. So when they are undergoing that, or they experience that, they are sometimes depressed, because how are people going to look at me now? I've lost weight, there's no hope for me. So we try as much as possible to provide support, emotional support, psychological counseling. We are there for them. They can open up and talk to us at any point in time. They feel that, oh, there's no hope for me, they can visit the health facility. We have counseling rooms or counseling sessions for people like that.
In the hospital?
Yes, in the hospital.
Okay, thank you. So Dr. Jessie, what are the causes of breast cancer?
Okay, so breast cancer, like other forms of cancer, does not have a specific cause. However, there are risk factors. The fact that you have a risk factor makes you more prone to getting it. So the commonest risk factors that we have are people's sex. So if you are a lady, you are more likely to get breast cancer compared to a man. Yes. So another risk factor too is your age. People who are above 40 years tend to have breast cancer compared to people who are in lower age groups. Yeah. Then there's also genetic or family history. Maybe a person's relative, mother, or grandma had breast cancer. So such a person is more likely to have breast cancer at a point. It's not a
Really?
given
Okay.
because there are other people who do not have any family history or relation
Yeah.
whatsoever, but
But still,
they still get breast cancer.
Cancer.
Then there are hormonal influences. So this is where the ladies come in. So one particular hormone, the estrogen hormone, is implicated in breast cancer. So wherever the body is exposed to estrogen, then the person is at risk of getting breast cancer.
Okay.
So let's say a person who had menstruation early, early menstruation,
Okay.
all the way to a late menopause. This person is exposed to the estrogen hormone and the person is at risk of getting breast cancer. Or if someone has a need to use additional hormone therapy,
Okay.
like for a person who is in menopausal stages or has done a surgery, so needs hormone supplementation, the person will be at risk of getting the breast cancer.
yeah.
Okay.
Also, ladies who have used contraceptives that contain estrogen for a long time.
Really?
There's some studies have shown that those people tend to be at risk factors. But that's not to say that all contraceptives should be thrown away because it's been noted that people who are at particular risk or significant risk are those who have used the contraceptives containing estrogen
Okay.
for 10 continuous years.
Okay.
Nti sɛnea mɛka no no, nneɛma bɛn na wowɔ bi a ɛma wotumi nya
Breast
no
cancer.
form
Yeah.
kokram.
Kokram.
Sɛ wate ase.
Yeah.
Nti baako ne wo mfe a wadi. Nti wadi aboro mfeɛ aduanan a wo risk no wɔ soro.
Okay.
Anaasɛ yɛyi ɔbarima na yɛyi ɔbaa a, ɔbaa no risk wɔ soro. Ɛna obi a n'abusuani nso so nya kokram yi bi pɛn, ɔno nso so risk no wɔ soro. So the ones that I've just spoken about, these are the things that we cannot do anything about it. In life, you are either born a male or a female, or when you go to other places, there are other categorizations. Or you can't do anything about your age too. Once you wake up every day, your age is increasing, your risk is increasing. Do you get it? But there are also other things that we can do something about. Nti risk factors ni bi wɔ ha a yɛbɛtumi ayɛ biribi afa ho.
Okay.
So we are talking about risk factors that we can modify, like your weight.
Okay.
Being overweight puts you at a higher
like
risk.
me like this.
Are you overweight?
I don't really know. I'm gonna say
Okay.
I'm fat. So.
Okay.
Yeah.
So overweight has a definition,
Okay.
like parameters that we use to determine if you're overweight or not. So one of the things that you can do is to walk into a nearby hospital. Then we tell you that this is your weight as at now. This is the weight you can lose to have a normal weight. Do you
Okay.
get it? Then there are also habits like taking alcohol. Studies have shown that there are no safe levels of alcohol. Even the least amounts can predispose you to
Risk.
breast cancer.
cancer,
Yeah.
okay.
Then there's smoking. Do you get it? Then there are eating habits. There are foods that are generally seem known to be carcinogenic. They make you prone to breast cancer. So we are talking about processed foods.
Processed foods.
Processed
okay.
foods, yeah, processed meat, sausages.
Hey.
For some of us, it's our lifestyle. We have to open a can every now and then. Once we get food, it puts that at risk. Then there's excessive consumption of red meat, beef, lamb, taking it excessively or continuously without balancing with other protein alternatives makes you prone to getting
Breast
the breast cancer. You get it? A sedentary lifestyle. When we move, we save our lives. So if you are sitting on your seat all day for hours without working out, without moving up and down, it puts you at risk of a breast cancer. Nti sɛnea make no, nneɛma no bi wɔ ha, wobɛtumi ayɛ biribi afa ho. Te sɛ sɛnea woso anaasɛ wonso fa. Wokɔ hospital, wobɛtumi aka sɛ ebi a weight no ɛwɔ soro kakra nti woluzu kilos mmienu a ɛbɛboa wo. Yɛaduanedie mu nso contribute bebree sɛ yɛdi breast cancer ho nkɔmmɔ a, nti obroni bɛka sɛ processed meat te sɛ sausage ne aduane a yɛaka ne a yɛ conserve anaasɛ yɛ store no, yɛde ɛno to aduane ɛnam a yɛankasa yɛano a obroni process na ɛno tumi ɛbɔ yɛn ho ban ɛfiri breast cancer yareɛ ho. So what you say?
Nti, then there are signs and symptoms of breast cancer.
Nti signs and symptoms of breast cancer. Anaasɛ nnwoma bi a wobɛhu anaasɛ ɛbɛda adi a yɛbɛka sɛ breast cancer mewɔ bi anaasɛ mewɔ yare bi a ɛsɛ mede kɔ hospital na yɛnhwɛ no.
Okay.
Deɛ ɛyɛ titiri pa anaasɛ common ones, we have the commonest symptom of breast cancer is a lump. So you woke up one day, you are done with your menstruation, you want to examine yourself. Wopɛ sɛ wofiri ho kakra na woehu aba bi wɔ unofo mu, or you feel a lump in your breast. That lump or that node wasn't there last month, so there's a change. That's a common symptom.
Okay.
Also, it's not limited to the lump. Ɛnyɛ aba ne nko a ɛwɔ unofo mu na ɛbɛma w'adwene akɔ hɔ. Wohu sɛ skin na ɛwɔ unofo ne ho, there are breast changes. So there's a sore on the breast, or your breast has a lot of points, like an orange. You see the way oranges have like these dots on it. We call it a pulled orange.
Okay.
So those things point to it. And also you could pay attention to your nipple. Is it abnormally gone inside? Is that a change from the normal? Or you've had like a bloody discharge unprovoked? It's different from having some bruises here and there from any other activity. Do you get it? Nti when you nnwoma ɛbɛda adi a wobɛhu sɛ onofo no biribi atɔkyema wɔ ho, sɛ honam na ɛwɔ ho no asesa, anaasɛ wohu aba bi wɔ mu, anaasɛ nsuo no ɛfiri onofo mu no ɛnkɔ yie ma wo a, wobɛtumi de akɔ ayaresabea. You can take action concerning these signs and symptoms.
Okay.
I want to add up to what Doc is saying. Usually our attention is just on the breast, but the tail of the breast is in the axillary. So when you are doing the examination, you have to start from your armpit area.
Okay.
Then you palpate from the armpit area towards the breast itself. A lot of times we forget that, that part, there was one woman who had a lump in the armpit.
Okay.
It wasn't in the breast. So all this while, her mind was, okay, everything is fine. Until she one day raised her hand, she felt, there's actually a lump in my armpit. And then lo and behold, when she went to the facility, she realized that, okay, this is a cancerous thing that was in my armpit. So our attention should also be in the armpit, not just the breast we see in front of us.
Thank you very much. That's a good point.
Okay. So how do you help patients cope with their treatment?
Okay. Like I said earlier, patients suffer from depression, anxiety, and all of that because of their diagnosis. So as much as we can, we provide support for them, counseling session. We educate them about their condition. We tell them that, this is not the end of the world too. There's always hope and there's always light. When you reach out early, you would get better results. And also, after the treatment, you'll be fine. You'll get back to your old state. So don't look at what is going on right now and then feel that, okay, I'm at the end of the road. No, there's always
Okay.
light at the end of the tunnel.
Thank you. So, Doc, what are the preventative methods of breast cancer?
Okay, so breast cancer prevention starts with all of us. That's why this platform is very essential.
Okay.
So we have to develop lifestyle habits. I've already spoken about the food that we eat,
Yes. Yeah.
our exercise routines, and limiting alcohol and smoking as much as possible. Also, we have to make it a routine to examine ourselves as as frequently as we can. So something that's realistic is every month. And I say, bosumi biano, ubetimi, efrion.
Okay.
So examining yourself starts from knowing what is normal on you. So usually one breast is bigger than the other. But when you notice that the bigger breast is getting bigger, or what you thought was smaller is now leveling up with the other one, then you can say that this is wrong or this is new. Do you get it? Uh-huh. So that's one habit that you can inculcate, like personal examination.
Okay.
Then another thing too is to have an annual tradition. So it's Pink October.
Yeah.
You can take advantages of a lot of clinics or facilities who are doing discounts for breast examination or breast screening. Do your annual breast check. Depending on your age, there are different types of breast checks that you can do. Then the third thing too is that if you see something wrong, go to the hospital. Yeah.
So, what are some of the myths of breast cancer that you like to debunk?
There are a whole lot of myths concerning breast cancer. Some of the commonest ones that we hear that only women get breast cancer. Even though the percentages of men who get breast cancer is very minimal, but you never know when that 1% is you. So, gentlemen, fathers and sons, I'm encouraging you to give attention to your breasts as well. Another common myth is also that the breast cancer is for the old ladies. But sadly, we've had cases of people in their 20s, in their early 30s, getting breast cancer, which they would have avoided if they were more self-aware, if they were examining themselves. Do you get it? Then there are also a group of people who think that breast cancer is pain. But when you've got to the pain level, then it might be unfortunate that your breast cancer is far gone. Because most of the time, the lump that will come is painless. Yeah, even the skin changes, you are not noticing anything painful. So it's all about being aware of yourself. People also think that once there's no one in my family who had breast cancer, I'm safe. So you say to the next person, oh, say what breast cancer no we but there are people who have had like strong risk factors. Maybe their mother had breast cancer and they've lived normal lives and died without having breast cancer
Yeah.
because they lived healthy lifestyles. They took good care of themselves. Then on the other side of the spectrum, ebinom nso so wɔ ha nim obi a ɔte ɔmo neighborhood mu kra ni breast cancer, but they have breast cancer. So it's not only having a family history of breast cancer that gives you breast cancer. Yeah, so those are the common myths that I want to debunk.
Okay, and a quick one. There is this saying going around there are these rumors going around that a woman has to get her breast sucked to prevent breast cancer. I don't know if it's true. How true is that?
Okay.
Yeah.
So
Interesting.
okay. So babies breastfeeding protects against breast cancer. But a woman getting a breast sac from other sources does not protect against breast cancer. However, those activities could be important in determining a change.
Okay.
A good case in point is that if your partner during the breast sucking activities or breast cleaning activity tells you that, oh, I've noticed that this thing is there. This is not the breast I've been sucking. This is not the breast I've been touching. It is a good point for you to know that something is off.
Okay.
But however, it's a myth, or it's not been proven that
Sucking the breast.
breast sucking, aside babies, protects from
Okay.
breast cancer.
Okay. Next, how do you contribute to breast cancer awareness?
Okay, so like Pink October, we create the sensitization, we educate people, we go to various organizations like the schools, the churches, and other places, just like your program today. We are here to educate people about breast cancer, and then early detection save lives. So that's all about it.
Thank you. So, Dr. Jessie, how often should we get checked?
So the check-in is at various stages. So I think a good thing to do is to do a monthly self-check.
Okay.
Then once a year, you can do your breast screening at a medical facility, be it during Pink October or any time that you set for yourself. But I want to also add this. If you are someone who has a strong family history, maybe your mother or your auntie had breast cancer, your risk is higher than the ordinary individual. So you don't need to do what the normal person does. So you can do more frequent checks. You can go to the hospital specifically to see a doctor so that we do the necessary investigations that we need to do for you. Some people go to the extent of taking their whole breast off, because if there's no breast, there's no breast cancer, right? Yeah. I think there's this popular actress who did that some years ago. Yeah.
Okay. Okay. So, what advice would you give to someone who is afraid to get checked of breast cancer?
So I think that we should replace our fear with action and our silence or our anxiety with knowledge. Because what's the worst that can happen? If you do a proper check or if you do a regular check, the chances are that even if you get a breast cancer, you will detect it in the early age, which is good because then your prognosis or your outcomes are better. Do you want to compare it to you not checking it at all and later finding out that
At the end stage,
you have a breast cancer and it has spread wildly to other parts? That's not helpful. Yeah.
Okay. So, what are the current treatment options for breast cancer?
So the treatment options for breast cancer is dependent on which stage that your doctor detected your breast cancer in. So a breast cancer that's just within the breast tissue is different from a breast cancer that has spread to maybe the the closer areas like the armpit, or has spread to organs like the lungs, the liver, the bone. So dependent on what stage that we detect the breast cancer or the breast cancer is diagnosed, there are various options. The commonest, there's surgery. So if you are good to do surgery based on the stage that we found it, you can take parts of your breast tissue, can take the lump outside, or you could even take the whole breast out. There are also medications, what we commonly call chemotherapy. Yeah, it's used in addition to the surgery, or sometimes it's used alone. You get it. Then there's also radiotherapy. That's a radio beams are targeted at the cancer cells to help manage it.
Okay. So, breast cancer can be cured, but it can be managed.
It all comes back to our conversation of regular checks, early detection. So let's make this one a comparison. If we find a breast cancer in its earliest stage, like is it's within a small part of the breast. If we do surgery to take that lump out and the areas around it, we've dealt with it.
Okay.
So in that case, you are cured.
Okay.
Do you get it? Let's compare it to someone who has breast cancer that has gone to,
Far end.
that has spread
Yeah.
to the lungs. We can only manage you.
Okay.
That's why early detection saves lives.
Okay. Nurse Miriam, how long is the treatment plan for breast cancer patients? Is it for a number of days, months, years?
Oh, like you rightly said, it depending on the stage of the cancer. In a case where they do the surgery and it's taken care of, you are fine, you can go. But in a case where we are doing the chemo for maybe 6 months, 3 months, it means you're going to be on treatment for that long. So
Okay.
it depends on the stage of the cancer. Then you would know how far you can go.
Okay. Dr. Jesse, please, your last words to our viewers out there. What advice will you give to them?
Okay. So I want to tell everyone that breast cancer is not a death sentence.
Right.
Yeah. Early detection saves lives. Early detection gives us better outcomes. Early screening or regular screening also gives us peace of mind. So breast cancer awareness, it starts with us, but also continues with you. Do your best to spread the word. Give support to people who have breast cancer, and also make sure that you do regular checks for yourself. Thank you.
Thank you. Nurse Miriam, what do you have for them?
Oh, what else can I say? Please, as much as possible, do your regular checks. Like he says, it cannot be overemphasized because every month, every lady menstruates. So after 7 to 10 days after menstruation, you could do it and then you have yourself checked.
Thank you very much.
You're welcome.
We've heard it all from Dr. Jesse and Nurse Miriam, and they are saying early detection saves lives. So you out there, visit any nearby hospital facility and get screened today.